Today, we will be exploring the drug Bezlotoxumab in terms of its pharmacology, success in clinical trials, and overall social impact since its introduction. To first understand Bezlotoxumab, we first need to identify why there was a need for it in the first place. Clostridium difficile infection, or CDI for short, is the most common cause of infectious diarrhea in recent years. The culprit is bacteria by the name of Clostridium difficile. This pathogen produces two strains of toxin, A and B, that in humans equates to inflammation and injury of the gastrointestinal tract. The main concern with this infection is that 25% of patients will experience a recurring infection of CDI after overcoming the initial illness. The more times someone is infected, the more resistant the pathogen is to treatment. Thus, Bezlotoxumab was born. In 2016, the FDA approved this fully humanized antibody for treatment of CDI in adults. So how does it work? As an antibody, it seeks to bind specifically to toxin B, released by the Clostridium difficile organism. By binding, the drug occupies half of the binding sites, inhibiting the pathogen from binding to human cells. The end result? It neutralizes the toxin and stops further destruction of host cells in the gastrointestinal tract. The drug is administered by injection for intravenous infusion and eliminated from the body by catabolism. But how effective is Bezlotoxumab at treating and preventing recurrence of CDI? In a global study that was conducted across 322 sites in 30 countries between the years of 2011 and 2015, trials were conducted that compared a control group that was treated with standard of care antibiotic and a group that was treated with Bezlotoxumab. Of the 781 participants in the Bezlotoxumab group, 80% achieved an initial cure from CDI, which was the same as the control group who achieved an 80% cure rate. The similarity between the two groups doesn't show us any meaningful difference between Bezlotoxumab and other standard antibiotics. However, looking past the initial clinical cure rate and looking in depth into how effective the drug was at preventing CDI from recurring, we can see that the Bezlotoxumab group achieved a cure rate of 64% in comparison to 58% cure rate in the control group. To conclude, Bezlotoxumab appears most effective in combating recurrent CDI when compared to alternative available drugs. These results are significant in showing that Bezlotoxumab is more effective at curing those with CDI than the standard of care antibiotics. Despite this, the study did have several factors that may have had an impact on the results: inconsistent standard of care, small participant samples, and external environmental and health influences. Current treatments for CDI is typically antibiotic-based. The use of a drug called metronidazole is often used for the first occurrence of CDI, and is only used for mild cases because of the nasty side effects of this drug at higher doses. For worse and recurring cases of CDI, the antibiotic vancomycin is used, where this drug is used in a pulse-type regime. For recurrence of CDI, the most effective treatment is vancomycin, coupled with a fecal microbiota transplant. This is a process where a donor's good stomach bacteria is administered into the affected person's stomach. While the most effective, this requires a health professional for administration, requires a donor, is quite expensive, and has had no large-scale randomized clinical trial. Bezlotoxumab can be used where CDI is recurrent and is highly protective against the effects of the toxins released by Clostridium difficile bacteria. This means that infections that manage to survive initial treatment are now able to be dealt with far more easily, with combined therapy using both Bezlotoxumab and conventional antibiotics. The social impact of Bezlotoxumab is significant, as returning infections make up to 48% of total cases of CDI and are the cause of over 60,000 deaths in the USA per year. Bezlotoxumab could significantly lower this proportion. The USA spends $2.8 billion treating recurrent CDI cases, and widespread use of the Bezlotoxumab drug could reduce this significantly.